Hello, and welcome to the Harvard Radcliffe Institute. My name is Claudia Rizzini. I'm the Executive Director of the Fellowship Program. The Institute is one of the world's leading centers for interdisciplinary exploration. We bring students, scholars, artists, and practitioners together to pursue curiosity-driven research, expand human understanding, and grapple with questions that demand insights from across disciplines. You can be part of this vibrant community by attending public programs such as this one, visiting virtual exhibitions, or pursuing the special collections held at the Schlesinger Library. To learn more, you can visit radcliffe.harvard.edu and sign up to receive more information on news and events. We'll begin the program with a presentation by David Hemenway. After the presentation, the speaker will respond to questions from the audience. Please use the Q&A feature on Zoom to submit your questions at any time throughout the program. We ask that you keep your questions brief to allow us to address as many as possible in the time that we have together. It is my pleasure to introduce this year's Elizabeth S. and Richard M. Cashin Fellow, David Hemenway, a professor of health policy at the Harvard T.H. Chan School of Public Health. He is also the director of the Harvard Injury Control Research Center and the Harvard Youth Violence Prevention Center. In 2012, the Centers for Disease Control and Prevention acknowledged Professor Hemenway as one of the 20 most influential injury and violence professionals over the past 20 years. It is no secret that gun violence is a major US public health problem. Statistics show on an average day, more than 300 American civilians are shot and over 100 die. Furthermore, the gun lobby has effectively blocked almost all federal government funding for research. During his time at Radcliffe, Professor Hemenway is engaged with his ongoing work to find common grounds between gunners and groups such as governors, faith leaders, and advocates to successfully confront firearm injuries. He will also begin a book that encapsulates what is currently understood about firearms and public health and the types of programs and policies that seem to succeed. A main goal of the project is to write for a general audience about firearms injury prevention and what a public health approach to the issues really means and why it might be effective. Professor Hemenway received his A.B. and PhD in economics from Harvard University. He is the author of 5 books and has written over 240 journals articles on injury prevention, including articles about firearms, violence, suicide, child abuse, car crashes, fires, falls, and fractures. His research has been supported by the Open Society Foundations, the Pew Charitable Trust, and the Robert Wood Johnson Foundation. In addition to his influential research, Professor Hemenway is a brilliant teacher, earning 10 teaching awards, university-wide recognition as an outstanding teacher, and an inaugural HCSA Community Engagement Award from the Students Association. We are fortunate to have him here with us today. And with that, it is my pleasure to give the virtual floor to David Hemenway.
Thank you, Claudia. That's so nice. And I also want to thank not only Claudia and Rebecca and Sharon, but so everybody at the Radcliffe Institute who have been so wonderful this year. A special thanks to Elizabeth and Richard Cashin for funding my fellowship. I also want to recognize my 2 wonderful Radcliffe partners, Chloe and Elizabeth. And finally, I just want to say how honored I am to be part of this incredible group of fellows, to be part of this cohort. I am so happy. So today I'm going to talk about reducing firearm violence from a public health perspective. I want to say first about how that gun violence really is a major US public health problem. And then I want to spend most of my time talking about the public health approach. And then at the end, sort of 2 examples of the public health approach in this area, talking about unintentional child firearm deaths, and then suicide prevention. So we have a major public health problem in the United States compared to all the other high-income countries. There are about 30 other high-income democracies. And when you compare us to these other countries, we have average rates of most crime and violence, but we have so many more guns, particularly so many more handguns, and by far the weakest gun laws. So this is just looking at 5 to 14-year-olds. I picked this group because this is a group of children. It's hard to blame the victim here, and there's so much victim blaming in this area. And what this says is that a child in the United States, basically this is K through 8, a child in the United States is more likely to be killed in a gun homicide than children, say, in Germany or Japan or Canada or Korea or France. And it's not 20% more likely or 50% more likely or twice as likely or 4 times more likely. It is 29 times more likely for a child in the United States per capita to be killed with a gun in a homicide. Our non-gun homicide rate is average. Gun suicides, a child in the United States is 9 times more likely to end up in a gun suicide. Something terrible happens at school. This 8th grader, he comes home, he finds his dad's semi-automatic, bang, he's dead. Our non-gun suicide rate for this age group is average. Our unintentional firearm death rate is 20 times higher. I teach at a public health school, lots of international students, they just don't understand why we allow this to happen in our country. Here's another sort of example. This just says, comparing across states, why do some states do so much worse and so much better in terms of violent death? And it really has to do with guns. This is not a study, but it just gives you a feeling for the size of the problem. Looks over a 10-year period, focusing on, this time, US women. What we did is we looked at states with the highest rates of household gun ownership and then states with the lowest rates and just compared them. The states with lots of guns typically have the weakest gun laws. And so what this says is that in this period we match, so you have about the same number of women years at risk. And what this says, looking at the bottom, unintentional firearm deaths, that over this decade, there were 25 women who unintentionally were killed with a gun in the low gun states in this decade, which is too many. But in the high gun states in the same period, there were 231 women who died. In the low gun states, in terms of gun suicide, there were 708 women in low gun states who committed suicide with a gun. In the high gun states, it was 5,669. You can see the non-gun suicide rate is about average. You can see the same thing happening in sort of gun homicides. Note that there's about a 10-fold difference, 8 or 9 or 10-fold difference in unintentional firearm deaths and gun suicides across these high versus low gun states. And only a 3-fold difference in gun homicides. And I think the big reason for that is that in gun suicides and unintentional firearm deaths, the guns which are used are home guns, guns found in the home, but in gun homicides, guns travel from states which have weak laws and lots of guns to states which have few guns and strong laws. So most criminals in Boston, for example, get their guns not from Massachusetts, but from Maine, Vermont, New Hampshire, and up I-95. One of the big aspects of the gun problem is that there are so many parts to it. We have to worry about gun accidents, gun suicides, gun robberies, mass shootings, and on and on and on. And it seems like for the foreseeable future, we're going to have lots of guns in the United States. We're not going to end up quickly like England or Japan, which has few guns and few gun problems. So what we have to do is learn how to live with our guns. Right now, we are dying with our guns. And I want to talk about the public health approach to try to reduce the problem. We've been promoting this approach for at least 30 years, and we're slowly getting some traction. More and more progressive police chiefs in big cities are saying things like, we can't just arrest our way out of our problems. We have to do more. And they're talking about the public health approach. Indeed, more and more people are talking about the public health approach. I went on Google the other day and just wrote the public health approach to, and all these things came up. It's basically, people are talking about the public health approach to bereavement and cybersecurity and fracking and hazing and malware propagation. I don't think people know exactly what the public health approach is, but it's really nice to see so many people are talking about how useful it would be. I want to talk about what I think is the public health approach. If you were to ask me to give a one-sentence description of the public health approach, I would say what we want to do is make it easy for people to stay healthy and difficult for them to become sick or injured. So what does that mean? It means we have an obesity problem in the United States. What do we want to do about it in a public health approach? We say, let's make it easy for everybody to get really healthy, nutritious foods. Let's make it really hard to get terrible junk foods. Let's make it really easy for people to get really healthy exercise. Let's make it harder for people to become couch potatoes. And what we do in the United States is completely the opposite of that. And it's like, why are we surprised that we have a big obesity problem? We spend a lot of time talking to people in criminal justice and people in medicine to try to differentiate the public health approach from those approaches. And I would say a key difference is that public health is all about prevention. In medicine and criminal justice, it's a lot about after the fact, you want to do something, somebody gets injured, somebody gets commits a crime, you want to do something about it. But public health is all about prevention before the problem occurs. And what we have found in almost all areas of public health, that there's lots of ways to prevent problems, and typically going far upstream is more cost effective. I'm an economist, so I care about cost effectiveness. And what we've learned too is that too many people tend to focus too exclusively on the individual with the last clear chance to prevent the problem. The public health approach is also population-based. In terms of medicine, in terms of criminal justice, it's really one at a time, not public health. Public health is at the population level. So a little before the pandemic started, I was giving a talk to psychiatrists in Massachusetts. And I said to them, do you know why that there's so many more suicides in Arizona than there are in Massachusetts, even though we have the same population? And their initial response was, the correct one was to say, gee, we didn't know that, nor why should they know that? That's not what they're interested in. They are interested in why the specific individuals whom they are treating get better. But then when I pushed them on it, why do you think they say things like, maybe it's the sun, or maybe it's the immigrants or something, or one person said maybe there aren't enough psychiatrists, but none of those are the answer. It's not even people in Arizona are not more depressed. They're not more suicidal in any basis in terms of suicide ideology, ideation, or even suicide attempts. The answer is they have lots of guns. The public health approach is also a systems approach, and it's really about thinking broadly about problems. What we're trying to do is a broad and inclusive approach to get everyone to help, to focus on shared responsibility rather than blame. And let me talk about that a little more. Public health approach is a harm reduction approach. It's trying to get everyone to agree in society we have a big problem. Now let's get everyone to work on trying to prevent that problem. And the focus is, instead of trying to figure out who to blame, it's to seeing everyone as part of the solution. In criminal justice, too often it's just looking at who to blame. My wife is a tort attorney. That's her whole life, is to try to figure out who's to blame. And who can help? And the answer is everybody could help. Gun manufacturers, gun distributors, gun owners, gun trainers, the faith community could do more, undertakers could do some things, the Surgeon General. We've been working with hairdressers and barbers, as well as distributors, owners, trainers. There's so many people that could help. And I've spent time recently talking to people in criminal justice, and it's like, oh, what does this mean? What should the police do? And what should hospitals do? And what should the clergy do? There's so many things that can be done. For example, what could criminal justice do? What does the public health approach imply? And it says, oh, you should do what you typically are supposed to do, serve and protect, but in a better way. but also you should broaden your activities to try to figure out ways to prevent problems rather than simply to respond. In Boston, for example, there's now social workers in police departments who have done a great job. In medical care, it's not only that medical care should do a good job fixing up patients and so forth, but they can do, and they're starting to do so much more in terms of prevention, going out into the community to try to prevent, making sure when people come in with gunshot wounds that they don't just stitch them up and send them back out to be shot again or to shoot somebody else, but to be able to figure out ways, programs, and policies to intervene to make the problem less. There are many parts of government that can do things too. The Surgeon General, the military is doing things, the public schools can do a lot more, state and public health departments and so forth and so on. And I think one of the things we try to emphasize is that thinking about what the government can do, everyone now is thinking about, oh, the government now can pass some laws, we can ban assault weapons, or we can require universal background checks, both of which are really good, but the government does lots of things which can help reduce the problem. The government creates data systems which are crucial in understanding and evaluating programs. The government funds research. Unfortunately, in this area, it hasn't done a very good job until quite recently. Government writes standards. The government's a huge buyer, and what it buys can affect policies and programs and can help prevent problems and so forth and so on. And public health, we're very optimistic because in public health, we've had so many successes. Public health is really a pragmatic, can-do spirit. I would argue that the big increase in life expectancy of the last 150 years in the United States, the doubling of life expectancy, is largely to do with public health, the sanitation revolution, the reduction in infectious diseases, and so forth and so on. Now, I want to talk about motor vehicles. In the end of the 20th century, the Centers for Disease Control was asked to write about what are some of the great public health accomplishments of the 20th century, and one of them was the reduction in motor vehicle deaths. This is a story that we in the injury field tell our graduate students over the campfire, so it's passed on from generation to generation. And let me sort of quickly tell the story. In the 1950s, motor vehicle manufacturers basically were saying, what we really want to understand is who caused the crash. What was that individual? Who was that individual? Why did they behave badly? And the notion was that it was all the individual driver's fault. And in some sense, that's true. If drivers were perfect, if drivers always obeyed the law, if they never sped, for example, if drivers never made mistakes, if they never were tired when they were driving or distracted, there would be virtually no motor vehicle safety problem. So what the motor vehicle manufacturers implicitly claimed is that then, if there's policies, they should focus on the driver because it's all the driver's fault. And the focus was on education and enforcement education. I'm in a cohort where everybody in my high school had to take driver's ed. There's a lot of important things we didn't have to take, but we all had to take driver's ed. The evidence now is that driver's ed did nothing to reduce our fatalities. And the other thing that motor vehicle manufacturers wanted to do is enforce the traffic law. This is exactly what the gun lobby wants to do now. They want to ask only who did the shooting, and if there was nobody who was a criminal, if there's nobody who behaved badly, if there's nobody who made mistakes, there'd be no gun problem. So their policies, they want to focus on education and enforcement. Education, they want to promote the Eddie Eagle program, which seems to have no effect at all, and they want to enforce the laws more and more strictly, even though the United States already is the most punitive country in the world. We have many more people in prison per capita than not only the other high-income countries, but in all the countries combined. Fortunately, in the motor vehicle field, public health physicians in the 1950s began asking a different question, not who caused the crash, but what caused the injury. And looking at it that way, it was pretty clear a lot of people, the driver was being killed when the steering wheel would go right through their chest. People were their faces were lacerated and they would die when their heads hit the windshield, which was not made of safety glass. They were thrown from the car and their heads would hit the cement or the hood of the car. Motorists would lose control of the car for a half a second and it would go off the road and it would hit lampposts and trees, which were planted right along the sides of major thoroughfares. Fortunately, we weren't putting lampposts along the sides of airport runways, but we were putting them along the sides of major roads. And public health physicians were saying, couldn't we make the cars safer? Couldn't we put in collapsible steering columns? Couldn't we have safety glass? Couldn't we have at least have seat belts and airbags? Couldn't we make the roads safer? Couldn't we have a better emergency medical system? And the punchline is, nobody thinks drivers today or in 2000 were better than they were when I was young in the 1950s. Drivers are a little better today in terms of drunk driving. Drivers are worse today in terms of distracted driving. But we really haven't done much about improving drivers. But what we did was we reduced fatalities per mile driven by over 85%. For every 100 people in my cohort who were dying, there's now only 15. So the key insight was you don't always need to change people. What you really want to do is create a system where it's hard to make mistakes and where it's hard to behave inappropriately. And even then, if some people still make mistakes and still behave inappropriately, you don't want anyone to be seriously injured. What does it mean not to make a mistake? Well, you're driving, you're so tired, it's late at night, you're going to sleep, your eyes closed, the car goes off the road, it hits a tree and you're dead. And it's your fault. Now, fortunately, what happens is in some places you start dozing off and you start leaving the roadway and you bump, you hit dots, which say, wake up, stupid, and you do, and everything is fine. Or now in a lot of cars, the car goes beep, 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 and it says, wake up, stupid, and you do, and everything is fine. And nobody is hurt, and the driver's not worse off or better off, has not done anything except be in a system which makes it harder to make mistakes or make it hard to behave inappropriately. We have drivers who speed. We have 6,000 pedestrians and 800 or so bicyclists who are killed every year by motorists. And what should we do? Make sure motorists behave better. Don't behave inappropriately, don't speed and so forth. We could have police all around, or we could just change the roads just a little bit. We could put in more speed bumps. We could have chicanes and neck downs. There are like 24 ways of what's called traffic calming by making tiny little changes in the roadway, and people will automatically slow down to the speed limit or without any enforcement at all. So an injury prevention text argues that it's hard to overemphasize the importance of the conceptual shift from a single cause behavioral explanation of injury to a multiple cause environmental explanation. Or another way of putting it, there are, for any injury, there are probably a dozen or more things that could have been done to prevent that injury, and what you're looking for are the most cost-effective interventions rather than waiting and focusing on the final actor. Focus is on prevention rather than blame. I love it. In my class this year, I was talking about this and someone asked over Zoom, if you don't blame the driver, who do you blame? The gunner's claim, if you don't blame the shooter, you must be blaming the gun. How can you do that? That's an inanimate object. How can you be blaming the gun? Conservatives say, if you don't blame the shooter, you must be blaming society. Is there no individual responsibility anymore? And for someone in public health, those are all irrelevant questions. The goal isn't to blame. The goal is to prevent. The goal is to reduce the problem. And often the most effective solutions do not involve determining who's at fault or who's to blame or who should be punished. Occasionally they do, but more often than not, they don't. Indeed, there's a real problem with focusing always on blame and finding fault, because what that typically means is if you say, oh, it's that other person's fault, I don't have to do anything. Nobody else has to do anything except that one person. And what we really need to do if we really want to reduce the problem is get everybody involved. An example, when I was in Washington, D.C. in the late 60s and 70s, early 70s, they were building the D.C. Metro. And they went out and they decided to build it in a way that made it safe. Now on the DC Metro, rape, murder, robbery, and assault are only about 25% the levels that we see on the subways on the T in Boston or New York or Chicago. And it's not because the people in Washington, DC area are so much nicer or less criminal than the people where I live or in New York. It's that the system is different, the environment is different, and that in the criminal justice biz is called SEPTEC, crime prevention through environmental design. Let me quickly talk about two examples. Unintentional child firearm fatalities. This is data using the National Violent Death Reporting System. I've done a lot of things in my career, but I think probably the most important is the minor role I played in creating this system. Every time there is now a violent death in the United States, there are more than 100 pieces of information collected consistently and comparably across all states. So we really are going to start to begin to understand what's going on. That's what we did in motor vehicles, which is one of the reasons we made such great success in motor vehicles. Why is this important? Here's one reason, is because we have people on gun advocates making this claim. John Lott over and over has made this claim. About 2/3 of accidental deaths to children are not shots fired by other little kids, but rather adult males with criminal backgrounds who are doing the shooting. And he says this on Fox News and on op-eds to the LA Times over and over, and doesn't seem to have had any data for this. But fortunately now with the National Violent Death Reporting System, we have good data on the circumstances of the death. And what we find is that it's not adults killing children unintentionally, it is children killing children. About 1/3 are self-inflicted, about 1/3 are other children as shooters, about 1/6 are teenagers. A 15-year-old shoots a 14-year-old, they're in the same class, but we have a cutoff at age 14. And about 1/6 are adults. Most of these are parents. There's no evidence that they are criminals. And now we have so simple data, so we can look at it, and we look at it, and it says, gee, let's look at it. Looks like as kids get older, they're more likely to be victims, but 2 to 4-year-olds stand out. They have a higher rate of unintentional firearm deaths than 5 to 10-year-olds. It's virtually all males who are victims. It's even more likely that the males are the shooters. Mostly it's other inflicted, but 2 to 4-year-olds are shooting themselves. At a friend's home, it's really important, but not until you're age 11 or 12 or 13 or 14. And we didn't used to have any of this kind of data. So what do we know? Now we know that most people are shot by typically an older brother or a friend. 2 to 4-year-olds have relatively high rates and they tend to shoot themselves. Many children are shot at friends' homes, but virtually nobody, no kid before the age of 11 or if you're a girl. So what does this mean for policy? It's pretty clear, 2 to 4-year-olds. We used to have lots of problems with 2 to 4-year-olds getting aspirin bottles and poisoning themselves and dying. And then we solved that problem largely by making child-proof aspirin bottles. We can do the same thing about guns. Over 120 years ago, Wesson of Smith & Wesson fame produced a child-proof gun. We could do much better today. His child-proof gun, you had to put a little pressure on the handle when you pulled the trigger, and 2 to 4-year-olds couldn't do that, just like they can't both push down and turn. For 12-year-old males, we have the Ask campaign. It says if your kid's going to somebody else's home, you should ask. I incredibly have an 11-year-old daughter, but I don't ask. Why? Because she's a girl, and secondly, because I live in Massachusetts. But if I had a 12-year-old boy and we lived in Louisiana, you would bet that I would ask if he was going to go play at a friend's house, whether or not there's a gun, and if to make sure that it was all locked up. One of the nice things about the National Violent Death Reporting System is that there are 2 narratives, one from the police, one from the medical examiner. I've read all these. I read so many deaths. And the most common circumstances, the kid comes home, finds his dad's semi-automatic, takes out the magazine. Here's all the bullets. He thinks the gun is unloaded. He's playing with the gun. He pulls the trigger. So usually nothing bad happens. Sometimes he kills his best friend. Sometimes he kills his younger brother. So what should we do? Well, we could blame the kid, we could blame the parents, blame, or we could solve the problem. All we'd have to do is start making all the semi-automatic so that when you take out the magazine, here are all the bullets in the magazine, but there is a bullet left in the chamber. Kids don't understand that, they pull the trigger. Just make sure that when you pull the trigger, the gun won't fire, and some guns have this already. Let me talk briefly about suicide prevention and then I'll stop. This is going to be magic. I'm going to talk about suicide prevention without changing anyone's mental health. Most people, when they consider suicide, they try to figure out why the person committed suicide and what we can do about it. And that all makes a lot of sense. What we have been doing is thinking about the how of suicide, how it's done. And I will argue that most of the great suicide prevention success stories in the last 75 years have had nothing to do with mental health. They've had everything to do with the means of suicide. An example comes from Britain. In the 60s, the leading cause of suicide death in Britain was putting your head in the oven. Pretty reasonable way to kill yourself. It's non-painful. It's non-disfiguring. It's a way, for example, that Sylvia Plath killed herself. In the 1960s, Britain changed the type of gas that it was using in stoves to make it and it was made non-toxic. And what happened was very immediately suicide rates dropped. Not only suicide rates from putting your head in the oven basically fell to zero, but overall suicide rates fell by 1/3. People still put their heads in the oven, and then after a while they take them out. Sri Lanka in the 90s had the highest rates of suicide in the world. There, the way they killed themselves was a horrible way. They drank liquid pesticides, a terrible way to die. Finally, Sri Lanka in the mid-90s stopped importing the most toxic kind of pesticides. And what happened is that people still drank the pesticides, but they didn't die. And then after a while, they were fine. The overall suicide rate dropped by 50%, an incredible change. And there was also no reduction in agricultural output. Here's a gun one, the Israeli Defense Force. A lot of the young men and women in the IDF were going home on the weekends and killing themselves. There's a lot of guns in Israel, but they were mostly military guns. Finally, in 2006, the IDF said you can't bring your guns home with you, which led to a decrease in overall suicides in the IDF by 40% because there are almost no weekend suicides. Now, what we've been doing is the Means Matter campaign. Kathy Barber and my group is just so great. She's been leading it. I don't have time to convince you, but if I had 45 minutes, I could convince you the evidence is overwhelming that in the United States, a gun in the home increases the likelihood that someone in your house will die of suicide by increases it by about 3-fold. And the evidence is so overwhelming. We've been pushing it for people who are suicide experts, and now everybody agrees. Every state health department in the United States has a suicide prevention plan that mentions guns and reducing access to lethal means. The US Army understands, the veterans understand. Now we're trying a bottom-up strategy, making sure that trying to get physicians to understand, first responders. But what I want to talk about briefly is working with the enemy in some sense, finding common ground, working with gun dealers, with gun ranges, with gun trainers. And Kathy has just done this incredible job finding common ground, working with them, trying to prevent suicide. And I could go on and on and on about why they're so easy to work with and to partner with, because we're all in this together to try to reduce suicide. And the message we are promoting that they love is in motor vehicles, there's the message, friends don't let friends drive drunk. Here, the message is, if your friend is going through a bad patch, if your friend is getting divorced and he's talking crazy and he's drinking, it should be your responsibility. He should know it. You should know it too. And this is their words, babysit his gun for a while until things get better. He gets a new girlfriend, things are looking up, he gets his gun back. This is being promoted by them as the 11th commandment of gun safety. They have created this most incredible public service announcement. Basically, it has a guy with earphones on to make sure he doesn't, his hearing doesn't go when he's shooting. He's clearly a gunner. He's at the range. He was shooting, bang, 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 bang. And then he turns to the camera and he said, last year, things were really going bad for me. I just didn't know what if I just wanted to end it all. My friends, they held my guns for a while. And he said, I think they saved my life. And then he goes back and he goes, bang, 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 bang. And after he puts his headphones on, and it's like the most positive message that says, yes, you can really do something. People go through bad patches. It's why there's suicide watches in prisons, because there are these periods where people are at high risk for suicide. And if you can get through those, the evidence is very strong that you're going to be able to live a long life. So changes. In the last decade, people in suicide prevention were not talking about guns. They thought it was much too controversial. And even though half or more of suicide deaths in the United States are gun suicides, even though very small, tiny percentage of suicide attempts are with guns, guns are so lethal. A decade ago, firearm experts were never talking about suicide because they claimed to believe that if you really wanted to kill yourself, you would. And that's not what the evidence shows at all. The evidence shows that easy access to lethal means increases the likelihood overwhelmingly that you're going to die in a suicide. Finally, today in gun shops and gun ranges in 20 states are starting to talk about suicide prevention. Gun trainers now in 3 states include suicide prevention as a key part of their training. But we have a big problem, is that only 30% of physicians in the United States still understand that a gun in the home increases the risk for suicide, and less than 15% of the public. So that's one of the things we're trying to work on next. I promised my publisher I would push this book wherever I go, whether it was appropriate or not. It's $25 on Amazon. It's Success Stories in Injury and Violence Prevention, called While We Were Sleeping. 64 documented successes about how the world has been made safer in terms of preventing injury and violence using basically the public health approach. 36 heroes you've never heard of. This is a book that I wrote for the parents and significant others of my students and their children too. When they are asked, why are you in public health? What is it about? Why is it different from medicine? Now they can just say, hey, read this book. Let me stop. Thank you. Send it back to Claudia.
Thank you, David. Thank you so much. A lot of information, very interesting. There are lots of questions, as you can imagine. The first one is about research and data, and it asks what steps are necessary for the CDC to be able to start collecting data on gun-related issues again. Right. I know that they're currently forbidden by law from doing that.
All right, so they were never quite forbidden by law, but they knew that if they tried to do anything, they would lose all their funding. So they didn't do it. For most people that don't really understand, for the last 25 years, people at the CDC have been so afraid that they even though they're in violence prevention and injury prevention, they at conferences refuse to say the word guns or firearms. They would fund, in the early 90s, they were funding research, they were collecting data, and they basically stopped for many years, especially the funding research. In the last couple of years, finally, things are looking much better. They're starting to fund a little bit. The funding, it's still low compared to the size of the problem, but in the last couple of years, things have changed to a significant degree. And so there's more and more people doing research, there's more money, more and more researchers are interested. So it's getting better, but we lost about 25 years of.
Yeah, following up from following on from that question, so this person asked, in hospitals, would it reduce infections by publicly reporting infection rates by surgeon or by hospital, motivating competition to improve local systems? Would it help to publicly report gun violence rates by municipality and or congressional district?
I don't know. People know where the gun violence is occurring. In terms of how well they treat it, maybe that you could have evidence about how well doctors are treating patients. I think what something should be emphasized is that there are some hospitals which are doing now an incredible job of trying to prevent the problem, where when someone comes in, they not only are treated for the injury, but they are tried to be treated for what really was the fundamentals that caused the problem. What was going on in your life that you were either a victim or shooter of this, and how can we help? How can we get you to the right kind of social services that will make your life better and make it less likely that you'll be part of a group that engages in violence, and you'll be able to do a much better job. And that is what I think in terms of hospitals need to be more and more emphasized. And a lot of doctors are trying to do a lot of things which are really public health things, which is just wonderful.
Right. Another question about data. How do we incentivize states to participate in the NVDRS? I assume you know what NVDRS.
Yeah, now currently all states are members of the National Violent Death Reporting System. The way they've been incentivized is the CDC gives the money. That's the way. The same way we have a great data system for motor vehicles. Everyone is incentivized by money, and it's not a lot of money, but it's so you have a number of people working, so you get the data. And now all 50 states for the first time are part of the system. They're just now getting the data. The states really began, some states in 2005 sending in data.
And have you seen
all
any?
The states are. Sorry,
have you seen any success in this arena?
Success in terms of getting better data, I think it's been crucial. And you know, the book which I am pushing, what I liked about all the successes is that data and research seem to matter, because that's what I do. It's like, oh my goodness, it seems to really matter. So in all the areas, people, you have data and research, so you really understand where the problem lies, and then you can evaluate what's going on. And so without the data and research, people just, it's sort of their best hunch. And that's sometimes good and too often not very good.
Right.
So I would say that the data and the research are crucial. I mean, an example not for motor vehicles, from motor vehicles rather than guns, is graduated licensing. Mm-hmm. The data and the research showed that 16-year-olds in the United States were at incredible risk for motor vehicle deaths. And then the research also showed there were 2 times when they were most at risk, and one was at night and one was when only other teenagers were in the car. And so what states started to do is they said, okay, you can drive if you're 16, because we know a lot of you need to transportation, and we don't have enough simulators for everybody to learn how to drive. You drive by being on the road. You can drive, but you can't drive at night. You can't drive with only other teenagers. And there's a drop immediately of 30% of their deaths. And you could find that out, and then you could show that by the data and the research. And without those, you couldn't do it. Now every state has that, and we've saved 30% of 16-year-olds who otherwise would have died. Now it'd be nice to save 50% or 75%, but it's still a big success.
Yeah. The next question, can you shed more light on how to reinforce community engagement systems and encouraging shared responsibility in a systemic manner?
Yeah, I'd like to. I don't think I know the answer to that. I can just tell you that when we were a youth violence prevention center, and the reason we were is because there was money that. I'm at a soft money school, and we have to raise our salary. And we worked in Boston, and Boston is great in a lot of ways. And one of the things we did is we tried to create a good data system for not only people getting killed, but for adults, what they thought about police, their interactions with the police. For high school students, the same way. And there's so many things we learned. We learned, for example, that were high school students at that time anyway were most afraid of all the places. It turned out to be on the T. And so you give that to a good mayor, you get that information, and the mayor says, oh, we're going to try to do something. We're going to try to change things. Boston has a lot of community nonprofits who are doing wonderful jobs, who didn't know each other very well, and we were able to help get them together, help get them access to, because we're a Harvard, get them access to the government, and give them ideas from working with each other, which was I think, helpful. And they're doing such, and then help promote the ideas that they had. They're doing such innovative things.
Right. Do you think that more people know about the risk of not properly securing guns? Have we gained ground in terms of publicizing this risk?
The answer seems to be no. I mean, what looks like, it's very sad in the United States right now, it looks like more and more people think that a gun in the home makes you safer. And they think that the only way to be really safe is to have the gun at the ready, so that when these hordes of whoever it is they're afraid of comes, tries to break in the home through the, that you have your AK-47 at the ready so you can just start protecting your family. So we've done, even though as the evidence has gotten stronger and stronger that a gun in the home increases your risk for suicide by a lot, for gun accidents, for homicide within the home, intimate partner problems. The knowledge of people has gone the other way. And so that's a terrible situation. And so we have to figure out how to change it so that, fewer and fewer people as a percentage of the population are hunting or target shooting, but what more and more people are buying guns for self-defense. Even so, the best estimate is that only a little over a third of households in the United States have guns. Only a little over 20% of adults are gun owners, but they have a lot of sway in politics. But the average gun owner is pretty reasonable. If you ask them, do you want any of the reasonable things that we could have, that they say sure, but then they don't vote for people who support those things.
Yeah. The next question, I guess it's one more thing for doctors to do. Do primary care providers, especially pediatricians, routinely ask at visit if there are guns in the home?
Yeah, no, they don't. It'd be nice if they do, and the key thing is the way to do it is that most pediatricians aren't necessarily experts on guns, but they're experts on children, and they're experts on child behavior, and they're experts on try to reducing risk of child behavior. So that should be part of the thing, asking if the kid is wearing their seatbelt, and if they're brushing their teeth, and if you're making sure that the medicines aren't readily available that they shouldn't have, and You're asking, if you have a gun, it's probably safer not to have a gun for young people, but if you really want to have a gun, make sure it's appropriately stored.
Right. The next question asks, one approach that has been pushed forward in recent years has been fingerprint ID locked guns.
Yeah.
As a method to present unintentional firearms death,
Yeah.
or firearms being discharged by unfamiliar users. Why do you think this has been so unsuccessful in gaining traction?
Yeah. The smart guns, one would think that this would be a good thing, that people would really like. Smart guns basically are so that only the authorized user could use it. The gun lobby has been very successful in getting people to be very afraid of the smart guns. Either if, once they're out there and if they're mandated, then it's another thing. Government's just trying to take away your guns. One of the things which I think is true is that, as far as I can tell, typically very new technology is not always the best. It's helpful often, but when I worked for Ralph Nader in the late 60s, we were pushing the airbag, pushing, you're gonna fall into this soft pillow. And first generation airbags were good, but they also killed about 250 people. And the second generation, the third generation got better and better and better. And that's, I think, true of all technology. And I would argue that the first generation smart guns are okay, but they're not perfect yet. I think one of the things the government should do is spend money on real money on research and development, since clearly the gun manufacturers are not doing that at all. For whatever reason. I mean, the gun manufacturers are doing the opposite. Instead of figuring out ways to make guns safer, they are figuring out ways to make guns more lethal and more militarized, and trying to sell those. You know, the reason we have seatbelts in cars is because the government mandated it. The reason we have airbags in cars is the government mandated it. It was like the manufacturers were trying to make the cars safer. It was just being pushed and pushed and pushed. And eventually they got better. And I think that has to do with competition from Scandinavia, because the Scandinavian cars were so much safer.
Right. The next question is, do we know if police violence is more likely in places where guns are more prevalent? Yes,
we do. That's something we actually have, our group has studied that a little. So quickly for everyone, you should recognize that in the United States, police are getting killed much higher than the rest of the developed world, and they're killing civilians. So compared to, say, a police officer in Germany, a police officer in the United States is 30 times more likely to be killed on the job, 30 times. And a civilian in the United States is 30 times more likely than a civilian in Germany to be killed by a police officer. And what we looked at is tried to look at across states. Why are police killed so much more often in some states than in others? We're talking about per capita. And again, the answer is guns. It's just like wherever you look, if the answer isn't race, it's guns or both in the United States. So often, the places where police are getting killed is places where there's lots of guns, because police are only killed by guns. 90 some, you know, it's not killed in virtually any other way. If you go to a domestic violence situation, if there's no guns there, you're not going to get killed as a police officer. If there are guns, you could get killed. And we looked at where are police killing civilians, and the answer is the same places, because they're killing civilians where civilians are much more likely to have guns. And police are correctly afraid. And there's a lot of other things involved, but if you're trying to explain what states police are killing the most people per capita, the one variable would explain so much more than anything else is gun prevalence. Have the U.S. military and Veterans Administration responded to your work? Any interesting partnership there? Yes, we've worked with the Army. We've worked with the veterans who are both really interested in suicide, and they really understand about gun suicide. So we've worked with them a lot in a lot of different ways, showing our data, working with them in collecting data in terms of, we do a lot of surveys. So they've worked with us about surveying their members and what the best way to figure out how to reduce the likelihood of completed suicide by getting guns away from people who are at very high risk. And you can do that voluntarily. That's probably the best way to do it. Right. I guess the next question is, what has been the resistance at government level not to change gun laws? Oh, huge resistance, huge resistance. I mean, I think the big problem in the United States is that guns have became part of the culture wars. Everything is, so you have the blues against the reds, and right now the Republicans are against virtually anything to do with anything about guns except to make it easier for people to get guns and shoot other people. That's the only thing that they're for. And so it's really very sad. We have, you know, mass shooting after mass shooting, and just waiting for a brave conservative to step up and say, we have to do something. That's how, like in other countries, good things have happened. In the United States, the reason in my lifetime we opened China was because finally Richard Nixon, a conservative, said we're going to go to China. In Australia, it's now 25 years ago that their terrible mass shooting occurred in Tasmania, and they really changed their laws really successfully. And they had a lot, and what happened there was the conservative prime minister said, enough is enough. I'm just not going to stand this, and we're not going to do it. And because the conservatives stepped up, who had power, they were able to quickly change the laws to make people safer, and they would. And the firearm suicide rate has plummeted. The firearm homicide rate has plummeted, and there for over like 20 years, there were no mass shootings there because there weren't the wherewithal to have mass shootings.
Right. How can we as a society overcome the politicization of guns? Motor safety was not a partisan or contentious as a public health issue. So it feels like gun safety has an extra hurdle to face.
Yes, and it's become, unfortunately, the same way with mask wearing. It's become the same way with climate change. It's just so sad, and we have to sort of figure out ways to overcome that, figure out what to come together on these things. So, you know, it's not like Americans disagree with a lot of the things. I mean, if you, and survey after survey, you say, you know, should we have these laws? Should we have universal background checks? Should we have gun licensing? And the overwhelming majority of people, including the majority of gun owners, say, yes, we should. We just don't get them. So we have to figure out a way to do things. I talk to people, you know, in other countries, and they think that one of our problems is that our political system gives too much power to single issue lobbies. I think a big thing that will change in the United States personally is when the legislature looks more like the people. Right now, the legislatures look more like gun owners because they're basically older white guys. And the older white guys are the worst in terms of thinking about reasonable gun policy. Women are so much better. Minorities are so much better. Everybody is so much better except older white guys, and they control the United States in terms of policies. So maybe that will change. But yes, we have to. And so what we're doing in our little way is trying to reach out to gunners and try to find common ground and say, look, there's a lot of things we can do. And let's start with suicide, because that really affects you. Who dies in suicide in the United States are not minorities so much. It's older guys, because they're the ones with guns.
Right. We have 2 minutes. Let's see if we can ask and answer these questions. So for people who cite having guns for self-defense, they always say it's to save their family when someone attacks them. You can't convince them otherwise. Is there data that this is fiction?
Yeah, I mean, it turns out people without guns are much, much safer than people with guns. Somehow there's this notion that the only way you can defend yourself with a gun. I mean, in the rest of the developed world, that doesn't seem to be the case. For 2/3 of the, of the households in the United States, that doesn't seem necessary to be the case. That you can do very well without guns, but it's hard to convince people otherwise. And that's true. And you can, the data, and we're trying to figure out sort of different ways to make a dent. I think one of the things that will matter is as the data get better, and then as there's more and more studies, sort of the constant drumbeat actually really matters. Even with smoking, there's the constant drumbeat. Here's a study that shows not only does smoking increase the chances of lung cancer, but it increases the chances of heart disease, and increases this, and it makes your children at risk. It does this, it does this. And finally, it made it easier for people to say, we shouldn't have smoking on airplanes. We shouldn't have it. And that, I think, is what may make a difference.
Right.
There are a lot of positive things happening in the last few years. Some corporations are stepping up. A few state governments are stepping up. Some hospitals are stepping up.
Yeah, that's great to hear. Thank you, David. This is all we have time for today. Thank you for the informative presentation and insightful perspective. I also want to thank you, our audience, for the terrific questions. I hope you'll be able to join us for other Radcliffe virtual programs. You can find out about future programs and watch videos of past events at radcliffe.harvard.edu. And with that, thank you again for joining us today. Have a good rest of the day. Bye-bye.